Please, 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 I can't breathe. Please, man, please, man.
Floyd's death ignited the anger of Americans and also the rising curve of its COVID-19 confirmed cases. As the country's employment rate remains low, its stock market rises strongly. Over 30 million people lined up for welfare. Meanwhile, over 600 people have increased $4 trillion to their assets. So for the United States, is COVID-19 pandemic a catastrophe or a wealth creation? Whose country is it? In America, any elder people with health care could move into the nursing home, which is as good as a hotel. The federal government will pay for the medical service. This was the America in our imagination, also a paradise for the aged across the world. Maybe the old people in Kirkland Life Care Center have never imagined that their lives would come to the end in March this year. It seems a curious day for the Life Care Center to throw a party after one senior began falling ill with fevers. 13 elderly people died within a week. In March, the US was still in early stage of coronavirus outbreak, and over half of the confirmed cases was from here. But 300 people in Kirkland Life Care Center, including both staff and the elderly, just received 45 test kits. More exaggerating, they had to line up for the nucleic acid test. For people of a certain age, their lives go by with the passing minutes. However, where are the medical supplies? When the old people in Kirkland face an agonizing week-long wait for the test kits, 1,800 people living 1,000 miles away, an isolated private island in Miami, received 1,800 test kits. The richest people in the US, merely 1% of the country's population, live on this Miami island. Of course, only helicopters and private yachts can get here. The COVID-19 testing rate in the island is 100%. The infection rate in the island is 0. This is the real paradise. We don't know where those test kits came from, when many states faced a shortage of testing machines at that time. After the outbreak in the US, a company named Blue Flame Medical was founded. Blue Flame Medical boasted that it could acquire masks, testing kits, and other equipment to respond to the pandemic. Actually, the founder of the Blue Flame company has no related industrial background at all. Blue Flame was started in late March by Michael Gula, a fundraising expert in national Republican politics. And the company received a very large orders in short term. Nobody knows how it has got so many medical supplies. Also in March, a program created by Donald Trump's son-in-law, Jared Kushner, has airlifted millions of gloves, masks, and other coronavirus supplies into the US from overseas. But it isn't clear who's getting them and at what price, or how much private sector partners are earning through the arrangement. The medical equipment, which can be found in many hospitals' ICUs, appeared in large number in the affluent neighborhoods in New York. Almost after 2 months, the old people finally waited for the medical supplies allocated by the federal government. In the almost forgotten nursing homes, over 28,000 infected old people were buried.
And wheezing around January, late January. My beautiful mother passed away yesterday morning at 6 a.m.
K Street is a major road in the United States capital of Washington, D.C., known as a center for numerous lobbyists and advocacy groups. Professional lobbyists are people whose business is trying to influence legislation, regulation, or other government decisions, actions, or policies on behalf of a group or individual who hires them. Lobbying is a symbol of U.S. democracy. However, it has become a political weapon manipulated by capital in reality. Since March, when some nursing homes complained about lack of money to buy medical supplies, capitalists in the medical industry spent millions of dollars in K Street. Forrest Preston is one of them. He owns the Life Care Center of Kirkland. At the beginning of April, Preston spent millions hiring high-priced lobbyists, hoping to exempt compensation for the families of dead. Those dead people who couldn't get enough medical supplies when they were alive. After death, they still couldn't escape the manipulation of intangible capital. As the coronavirus death toll in America's long-term care facilities surges, the nursing home industry is aggressively seeking legal protection from grieved residents and their loved ones. At least 19 states have enacted laws or issued executive orders that either explicitly grant nursing homes and their workers legal immunity during the pandemic, or that appear to do so. Although the per capita medical expenditure for a COVID-19 infected patient is as much as $20,000, medical insurance could cover most of the expenses. However, in the US, nearly 30 million people can't afford a medical insurance, let alone a $3,000 respirator or $10,000 a day in the ICU. Every minute is luxurious. A dying patient unplugged his breathing machine by himself. The last words he left for his wife is, "Who's gonna pay for it?" A nurse witnessed the whole course and wrote in her diary, "This country is truly a failed state, and it's so sickening to witness firsthand, more blatantly than ever." Dating back to 11 years ago, some medical workers cried for the high medical treatment fees in protest. The luxury mansion behind them lived Stephen Hemsley, CEO of United Health Group Inc. The protest paid off. 4 months later, the Senate passed an alternative health care bill, the Patient Protection and Affordable Care Act. The bill increased the number of Americans with health insurance by providing new premium tax credit for the purchase of private health insurance and make a number of reforms to the private insurance market. However, the stock price of United Health Group kept shrinking after the passing of the bill. The company's annual earnings once approached Apple Inc., but it lost nearly $275 million within 3 months. Before the 2016 presidential election, United Health Group donated millions to political causes. Republican John Barrasso, who took the most of the money once from the United Health Group, was a strong opponent of Obama's healthcare reform. In 2011, Trump repealed Obamacare. The hidden troubles finally occurred after 3 years. During the coronavirus outbreak in the US, 40% of American patients have to give up medical treatment due to lack of health insurance. Most of them are middle-low income group and colored race. They can't afford to buy business insurance and are not eligible to apply to free public health care. Some even lose jobs and have the issue of survival due to the pandemic, let alone go to see a doctor. They can only pin their hopes on American welfare policy. But what they didn't know is that they would face formidable competitors. In March 27, President Trump signed a $2.2 trillion coronavirus rescue package, the highest in U.S. history. Over 90% of Americans could get a $1,200 check under the CARES Act. However, the relief fund only accounts for less than 30% of the budget. Where was the other 70% of money going? Provisions in the CARES Act changed a 2017 tax law in a way that will largely benefit Americans who earn $1 million or more annually. U.S. millionaires received $1.7 million in COVID-19 stimulus checks. That's about 1,400 times the amount a low-income worker could receive from the federal government's COVID-19 economic relief package. Over the past 2 months, the coronavirus killed over 130,000 people in the U.S. Some bid farewell to the world, while some witnessed their wealth increasing substantially. 200 years ago, Thomas Jefferson penned, "All men are created equal" in the Declaration of Independence. Did he ever expect today's America? This is the best of the times. This is the worst of the times.
Let the world know whose lives are we willing to sacrifice. Are we willing to sacrifice those low-wage workers that are going out, making $8, $9, $10 an hour? They can't afford health care. We willing to sacrifice them? Or is that the population that we're willing to sacrifice? Because if the medical professionals have told us that lives will be lost, let us begin to count who we're willing to sacrifice.
I'm Kathy Chen, that's all for today's video. Thanks for watching. If you like it, please subscribe and leave your comment. Bye.